Hi, I'm Rosemary Clee, the Executive Director for the Bergen Newbridge Medical Center Foundation, the fundraising arm for New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I am joined by Darian Aletta. Darian is a licensed professional counselor, an LPC, who helped create and facilitate the LGBTQIA plus group curriculum for patients in addition to educating staff on providing culturally competent care for their LGBTQIA plus consumers. Her work with the LGBTQ plus patients allowed her to become the mental health provider for Bergen Newbridge's LGBTQ plus Health and Wellness Center, assisting the creation of and the implementation of the center's opening and present mental health operations. She is currently the director of outpatient behavioral health services, overseeing acute hospitalization program, outpatient behavioral health clinic, and the children's intensive outpatient program. Discussing and gender pronouns sets a tone of allyship. It can truly make all the difference, especially for new community members who may feel especially vulnerable in their surroundings. Pronouns are one way we express our identities. When someone requests that you use their pronouns, they are requesting that you respect their identity. Thank you, Darian. As we close out Pride Month, understanding pronouns is so very important.
It is. Thank you so much for having me, Ro.
Thank you. So, what's the meaning of LGBTQIA plus?
So, to break down the terminology, LGBTQ plus means lesbian, gay, bisexual, transgender, and the Q is kind of interchangeable. The Q can mean questioning, meaning someone is still figuring out where they identify on that within that realm, or it could mean queer, which is a little off-putting for some people, but originally the term queer was used as a pejorative slur, but now it has become an umbrella term that describes a myriad of ways in which people reject the binary categories of gender and sexual orientation and express who they are. So the community is kind of taking the word back. So it's really, really an empowering thing when we hear that the community use the term queer. I means intersex and A means asexual, and the plus is to include everybody in all different communities.
Oh, okay. So, what's the difference between sex, gender identity, gender expression, and sexual orientation?
So that's a great question because I think this is where a lot of confusion comes up because we kind of see these things as interchangeable, but they're actually quite different. So sex is someone's biological makeup, such as their genes, their chromosomes, their physical characteristics, and gender identity is how someone feels on the inside. A gender expression is an individual's physical characteristics, their behaviors, their presentation that are traditionally linked to maybe masculine or feminine, and or maybe androgyny, such as appearance, dress, someone's mannerisms, their speech patterns, the roles they play in their relationships, or their social interactions. And sexual orientation is about who you're attracted to and who you feel drawn to romantically, emotionally, or sexually. And it's important to note these things can happen on a spectrum. So just because, someone might go one way or the other doesn't mean that we are all one thing or all the other. It can happen in a very fluid way.
Makes sense. Makes sense. So, what are the right terms to use?
It's a big question, but I think that it's important when we talk about terminology, we have to be super considerate that language is fluid and language can also be subjective. So language changes over time and different people may use terms differently. So kind of like when we talked about the word queer in the beginning of our discussion, that's another example of how terminology can be interchangeable with different things. So a good practice is to educate yourself on the ways in which the different terms are used, as well as the concepts are used in your location, because different geographic locations might have different meanings for different things. And you can also do this by attending LGBTQ plus community events, participating in culturally competent training, and reviewing resources on terminology such as the Human Rights Campaign. They have this massive dictionary on their website that has terms that I've never even heard of. And it's such a great educational resource for people who maybe hear a term and don't know what it is and want to learn. And you can also go on the PFLAG website, which is a great resource for people who want to be allies to members of the different communities.
Good to know. Good to know. So, what are some of the terms that we're hearing more in mainstream culture recently?
So I think a lot of what we're hearing right now are terms regarding sexuality. And, we're hearing terms such as pansexual, asexual, gray sexual, demisexual. So, we've heard of bisexual before, and bisexual is a person who's emotionally attached to more than one gender. Or I'm sorry, they're emotionally or sexually attracted to more than one gender. We hear a lot about pansexuality. A person who identifies as pansexual is a person who could be attracted to anyone regardless of their gender identity. And asexual is a person who doesn't really fit the traditional standards and expectations around sexual desires. And many people in the LGBTQ plus community think of sexuality again on a spectrum. So sexuality is just one end of the spectrum that identifies in between. So someone who is asexual may not be sexually active, but they still maybe are attracted to people, but not desire, physical intimacy. So it can kind of be confusing for some people, but then we also hear, demisexual. I know a lot of people see a lot of celebrities are now coming out with more sexual identities and maybe are not as mainstream, but they become popular or become more well-known because we see celebrities identifying as them. So demisexual is one that we've been hearing a lot lately. And demisexual is a person who doesn't experience sexual attraction unless they have a strong emotional connection with somebody. So that can mean a romantic relationship or a deep friendship. So we're kind of taking gender away from it and talking about emotional connection. And a lot of, people think that demisexuality is a choice, but it's not. It's an innate orientation. So something to consider. And something that I recently read, I'm always learning, I'm always reading. When I hear something, I always want to learn more about it. And I heard a term called gender expansive, which I thought was such a great term. And it's an umbrella term used to refer to people who don't identify, which in traditional gender roles. So it's such a great term to use for somebody who maybe doesn't see themselves as masculine or feminine. And it's respectful to call somebody gender expansive. And if they say they're gender expansive, now we can understand what they mean by that. So I love that term. I just wanted to share that term.
Oh, I like that too. So how do I know what pronoun to use if I'm not sure?
This is a question that I get a lot because a lot of people, when approaching the pronouns conversation, get super uncomfortable or they're afraid they're going to say the wrong thing. But it's such an important question to ask when we're getting to know somebody. I mean, especially when I'm coming from, the mental health care background, this is such an important conversation in a patient's treatment. So I always recommend asking respectfully rather than guessing. So maybe because someone presents as traditionally male or female doesn't necessarily mean that that's their pronouns. So you can say something such as, I want to be respectful and I want to honor your experience. What gender pronouns do you use? Really simple, to the point. It's very important for us to respect each person's identity, and individuals may not use traditional male or female pronouns. Some people use a gender neutral pronoun such as they. That's a popular one that we hear now. And sometimes people use a mix of pronouns. I've heard that before as well. But we never ever use any derogatory terms such as it. We always use whatever the pronoun somebody gives us is the pronoun that we use. And what I find that sometimes happens is, especially in the course of treatment with somebody in the community, maybe perhaps they're going through their gender affirming surgery, maybe perhaps they're exploring their gender identity more, and the pronouns switch. And sometimes as humans, we are flawed and we make honest mistakes, and maybe we use the wrong pronoun. But if we catch ourselves doing that, it is so important for us to acknowledge that we made a mistake, apologize, and move forward. The worst thing I think someone can do is not acknowledge that they made a mistake and kind of ignore the fact that we just really invalidated somebody. So we're human, we make mistakes, but it's really important that we ask questions. And that's a really good question to ask somebody.
So I'm going to go on the ally and the generational piece, and you brought out a really good point of, sometimes you just don't know, and you kind of, you assume.
Mm-hmm.
What can someone that is in the LGBTQIA community, if they come across a generational, some language that they can use that's not offensive to the generational person, to say, hey, I don't identify with that, gender, that pronoun. I'd rather you identify me this way. How can somebody say that?
I think it's always best to lead with an emotional deposit. I appreciate that you see me this way, or I can see that you're perceiving that I am X or Y. However, I identify as, male, female, gender fluid, maybe they are gender queer. And it's important to just kind of politely correct somebody, because sometimes people make honest mistakes. And again, we see what we see. And sometimes it's an uncomfortable question to say, are you male? Are you female? So that's an uncomfortable question. So it's important for us to advocate for ourselves and use proper assertiveness skills and say, hey, I noticed you called me he. My pronouns are actually she. I'd really appreciate it if you could honor my pronouns and call me by my pronouns. So again, we're human. We want to, also use that opportunity as a learning opportunity for someone to facilitate allyship with the community.
Agreed. And I know that, when it comes to generation and culture, it's
Mhm.
difficult, and you certainly don't want to continue using the incorrect pronouns. You do want to, fix it, but, sometimes the communication falls back. So how prevalent are mental health issues among the LGBTQ?
We noticed that there's higher rates of things such as depression, anxiety, suicidality among members of the LGBTQIA community. And that can be for a myriad of reasons. Some of the most stressful components of being a member of the LGBTQIA plus community is, the coming out process, what that's like, if there's ramifications for that, if you have people in your life who are unsupportive. Trauma can come from various, everyone has trauma, but, a lot of members of the LGBT community experience trauma in the sense that when people identify them as part of the community, they get physical violence used against them, verbal aggression, because people don't understand and they sometimes behave in really, really horrible ways. Rejection, as I kind of mentioned earlier, rejection from their loved ones, from society. We like to believe that we live in a day and an age in 2022 that everyone is more inclusive and understanding, but I think that we're still finding that there are some people who just don't accept the community. Substance abuse is more prevalent among the LGBTQ plus community. Nicotine use is higher, and homelessness can be a huge issue for many members of the community. And again, like I said, suicidality. Just one statistic when I was doing some research for this, the Trevor Project, which is an incredible nonprofit organization that helps transgender youth. They did a survey for 2022, and they interviewed 34,000 individuals, youths, and they found some data. And although that's a relatively small sample size for, the population of our country, what they found in that data was that 40% of transgender adults have attempted suicide in their life. And compared to the less than 5% of the general US population, that's a huge number. And they found that 73% of LGBTQ plus youth reported experiencing symptoms of anxiety, including more than 3/4 of them being trans, identifying as trans. So we see them having symptoms of depression and anxiety at a much higher rate because of these different contributing factors. And also, too, what members of the community have is called minority stress, in which a minority group in society experiences more stress because the majority group puts that stress on them, or they feel that they're not accepted, or they feel as though, if they were to come out, if they were to be who they truly are, they would be rejected, they would have, violence used against them. So they have unique stressors that make it harder for them to get treatment. And, many of those who seek treatment, or not necessarily seek treatment, let me rephrase that, those who want treatment don't necessarily go and get treatment because there is a fear of stigma. There's a fear of being judged. Many members of the community find that when they go seek help, whether it's medical or mental health, not every professional or provider is educated in their unique issues, and they do sometimes do minority aggressions against them. Maybe they don't intend to, but that people make assumptions like, someone who presents as traditionally masculine, people do intakes and they say, oh, do you have a wife? Do you have a girlfriend? That's a microaggression. So even when they do identify that we have these mental health concerns, not every single person, in fact, many members of the community are apprehensive to get help. So it is a challenge, and it's a responsibility of an ally to advocate for members of the provider community, the mental health community, and the LGBTQIA plus community to seek help and be there for each other.
Agreed.
Yeah.
So what are the biggest concerns and challenges of the patients that you treat?
The biggest concerns and challenges is, what I kind of just described, getting them to come in the door and be willing to come in the door. And it's intimidating enough to seek mental health care because maybe we have our own cultural stigma, societal stigma that says, oh, you're going to a therapist, you must be, quote unquote crazy. There's these ideas that if you seek mental health care, you're on psychiatric meds, you're different. But the community faces unique challenges in that, they want to receive compassionate and inclusive care. And that is their biggest concern, that they will not be accepted by their provider, that they will be mistreated, that their gender or their sexual orientation will be assumed. So something that we encounter a lot, but when we created the LGBTQIA plus center, we made sure that we wanted to make an environment that is accepting and welcoming, and making sure that our providers are educated on these matters so they can be as supportive as possible.
So what can we as parents, friends, colleagues do to support someone we love?
I think the best thing we can do is become educated. We need to read on the cultural issues that the members of the communities face. We need to become knowledgeable on the terminology and pronouns, the importance of it, and become familiar with them. And if you don't know, be willing to learn. I hear terms that like I said earlier, I don't even know all the terms. And if somebody I'm working with or somebody I'm talking with outside of my professional life says a term, I was like, hey, I don't know what that means. Can you explain that to me? Always be willing to learn and always be open to hear what somebody has to say. And you don't have to know every term, but you just have to be open-minded. And I think that willingness and asking questions just totally opens the door to build such a healthy relationship with our loved ones who are members of the community. So, we always have to be willing to ask questions, because I think many people get a little apprehensive because they're nervous to ask the question because they think it's disrespectful to ask somebody, but it's actually the biggest act of care to ask a question and be curious. And, we have to own up when we make a mistake, if we misgender somebody, if we, don't understand the term they use, if we make a mistake and we're honest about it and we're apologetic, again, like that's how we heal the relationship. That's how we create a healthy relationship. So owning when we make a mistake and being an ally all the time. It's one thing to say we're an ally, but being an ally is a constant day-to-day thing. So, we have to act our support as much as we give our support verbally. And we also want to seek to understand different perspectives that may not be a part of our experience. We want to build bridges between the community and the allies. So we have to be open to what their experience is.
And these are all really great tips. I mean, I know that it's, I'll go back on the cultural and generational, it's a struggle, to come with the right language, to come to an agreement and to be supportive, and when it comes to this community and young people and people that are just part of the community, you want to be able to support them as best as we can, so I really do appreciate you taking the time today to talk to us. And, we do have such a unique wellness center here, educating our staff, educating our community, and really trying to create a comfortable, inclusive piece of care. Healthcare is by far, something that we really need to work on. So when it comes to this community, so I do appreciate you joining us. And please, if you want to learn more about Bergen Newbridge Medical Center and its Wellness Center, please visit us at newbridgehealth.org. And thank you again, Darian, for sitting with me today and really defining all of these pronouns. I appreciate it.
You're very welcome. Anytime, Ro.
Thank you. Take care.